First up, what exactly is iron deficiency? It's pretty straightforward. Your body just doesn't have enough of the mineral iron. Think of iron as the essential ingredient your body needs to make hemoglobin. Hemoglobin is the protein inside your red blood cells that is responsible for carrying oxygen from your lungs to the rest of your body. It can be anything from a diet low in iron, blood loss from things like menstruation or ulcers, the increased demands of pregnancy, or even poor absorption due to conditions like celiac disease or gastritis. Now, let's talk about anemia. Anemia is a different ballgame. Other causes include chronic diseases like kidney disease, genetic conditions like sickle cell anemia, or even your body destroying its own red blood cells in what's called hemolytic anemia. So, being low on iron is just one of many possible reasons you might be anemic. So, what are the key differences? Let's put it side by side. Iron deficiency means your iron stores are low, but your hemoglobin might still be okay. It's the early stage. Anemia means your hemoglobin is low, reducing your body's oxygen carrying capacity. It's the final outcome of a problem. Here is a simple way to think about it. Iron deficiency is the lack of a raw material. Anemia is the lack of the final product. And yes, you can absolutely have one without the other. It's very common to have iron deficiency without anemia, especially in the early stages. Your body is using up its iron reserves, but it hasn't gotten to the point where it can't make enough hemoglobin yet. This is often seen in women, athletes, and during pregnancy. On the flip side, you can have anemia without being iron deficient. This happens when the cause is something else, like a B12 or folate deficiency, kidney disease, or chronic inflammation. This is exactly why blindly taking iron supplements can be a bad idea. If your anemia isn't caused by low iron, those pills won't help and could even cause other problems. The symptoms can also give us clues. With iron deficiency, you might feel tired, have strange cravings for things like ice or clay, experience hair loss, or notice your nails are brittle. These are like early warning signs, but when anemia sets in, the symptoms often get more serious because they're directly related to low oxygen. You might experience shortness of breath, a fast heartbeat, have noticeably pale skin, feel extreme exhaustion, and in severe cases, even have chest pain. Anemia symptoms are your body screaming that it's not getting enough oxygen. So how do doctors figure this out? It all comes down to specific blood tests to diagnose iron deficiency. The most important test is ferritin, which measures your body's stored iron. They'll also look at your serum iron and transferrin levels. To diagnose anemia, the main test is for hemoglobin and hematocrit. If those are low, they'll do more digging to find the cause. Think of it this way. Ferritin tells your iron story. Hemoglobin tells your anemia story. Finally, let's touch on treatment. For a confirmed iron deficiency, treatment usually involves iron supplements, often paired with vitamin C to boost absorption. You might also be advised to avoid tea or coffee right after meals since they can block iron absorption. Fixing anemia always starts with finding the real cause, not just guessing. So the big takeaway is this: iron deficiency is a lack of iron. Anemia is a lack of hemoglobin. They're connected, but they are not the same thing. Before you ever start taking an iron supplement, please get tested and talk to a healthcare professional. Your body deserves the right diagnosis to get the right treatment. Thanks so much for watching, and if you found this helpful, be sure to like and subscribe for more health explainers.